Hi viewers, today we're going to be talking about a very important subject, and it is titled as Secrets of Sleep. The purpose of this series of talks is to show that sleep is one of the basic and the most important processes of life. This video is a must watch for everyone, whether they have experienced sleep problems or not. Reflecting on the issue of sleep, which I've done for many years in my work, I never cease to be amazed that it is a masterpiece, part of human creation. I will now attempt to present this rather technical issue in an easily described talk as it systematically unfolds. So we'll be talking first about a historical view of sleep, as Sigmund Freud, who is a very famous neurologist, subsequently became a psychoanalyst. He writes, "The world, it seems, does not possess even those of us who are adults completely, but only up to 2/3. 1/3 of us is still quite unborn. Every time we wake in the morning, it is like a new birth." Very aptly said by Sigmund Freud. When we go to bed at night, we enter an altered state of consciousness that lasts for a number of hours. And during this time, we cease to hear, see, and cannot feel consciously what is happening around us. The world of sleep and the world of wakefulness is so different that each one of us could be said to live in two worlds. This difference is particularly striking when we wake up suddenly during the night and we are not immediately aware of where we are. The French writer Marcel Proust has given a beautiful description of this transitional state. He writes, and I quote, "But for me it was enough if in my own bed my sleep was so heavy as completely to relax my consciousness, for then I lost all sense of place in which I had gone to sleep. And when I am out of the orchid midnight, not knowing where I was, I could not be sure at first who I was." The word sleep, as we speak in English, is of Germanic origin and derives from the word sleps. So does the word slumber, which also has a Germanic origin, as does the word doze. The word dizzy also has the same roots. Thus, to fall asleep is something used as a euphemism, for thus to die whilst asleep that knows not break means death. The euphemism to sleep on something, meaning to delay a decision until the next day and to put a certain problem in perspective so as to we can decide on it the next day. The other everyday expressions is to sleep together or to sleep with someone. Refers to an act that is not directly connected with the phenomena of sleep itself. A very interesting concept, if you read the literature. Sleep is equated as the brother of death. The Roman poet Ovid called sleep a counterfeit of death. The stillness of a sleeping person is something really bewildering about it. It's often that peaceful sleep at first glance can easily be confused with a death-like state. In the Shakespearean play Juliet, she takes a drug to induce a death-like sleep for several days in order to seek escape from the unwelcome care of a family. When we are asleep, we are exposed to the dangers of the world. We ask ourselves, will we wake up again from this mysterious state? In the face of this worrying question, it is not surprising that people say a prayer before going to sleep. I lie down and sleep. I wake up, for God sustains me. Or similar prayers. How is sleep different to other states of unconsciousness? Sleep occurs in a predictable pattern. During the shift from wakefulness to sleep, there is a progressive decrease in neurological response to the environment, which means that we do not respond to auditory and visual stimuli, or the brain does not accept these stimuli. What is sleep? Extremely interesting question, but it has been described as a natural cyclical alteration of consciousness that is essential to the normal functioning of the brain, including the normal functioning of our physical health. It is a biorhythmic state of unconsciousness. The brain becomes less sensitive to external stimuli. The question is, when we are sleeping, does it conserve any energy, or does it allow the brain to recharge? As regards to the first question of conserving energy, this is something of a misconception. Literature suggests that sleeping only reduces metabolism and energy use in humans by at the most 5 to 10%. Over an 8-hour period of sleep, this will equate to approximately 50 kilocalories. Sleep plays a significant role in brain development, and deficiency of sleep, especially in the long term, can lead to serious health problems. On the other hand, sleep deprivation hinders brain function, especially the regions that control memory, planning, language, and sense of time. Judgment is also frequently affected in sleep deprivation states. Research suggests that remaining awake for more than 17 hours is likely to reduce cognitive functioning, leading to psychomotor retardation, impaired performance, to the same extent as that would be caused by a blood alcohol concentration of 0.05%, which is essentially the legal drink driving limit in the UK. It's important to understand that sleep deprivation impacts also normal physiology. Lack of sleep has many causes, and it is associated with several conditions, which include mental health conditions like depression, anxiety, obesity, and physical health conditions like heart disease and type 2 diabetes mellitus. Sleep disturbances can also be because of illicit substance misuse or substance dependence or drug addiction, whatever you wish to call this. In certain cases, it has been my experience to see that use of illicit substances initially starts as a method of self-medicating to improve the individual's sleep pattern. And very commonly do we see intake of alcohol, cocaine, and benzodiazepines at night. So what happens to the brain during our sleep? The quality of our sleep directly impacts on how our brains function. Whilst we are asleep, the brain performs vital restorative functions. It also processes information, emotions, and memories. The average person will repeat the 4-stage sleep cycle between 4 to 6 times per night. So the 4-stage sleep cycle, each stage has a different level of brain activity. For example, it is much easier to rouse a person in the first stage of sleep rather than the 4th stage of the sleep, or the 3rd one for that matter. After the first hour of sleep, brain waves have a tendency to slow down, the muscles relax, and the heart rate and blood pressure, along with body temperature, decreases. In the latter stages of sleep, which is known as the non-rapid eye movement or REM sleep, which is a deeper, more restorative sleep, the body works to strengthen the immune system and repairs damaged tissues. It is most difficult to wake somebody during this sleep stage. During rapid eye movement sleep, we find the final stage of the sleep cycle, brain activity is heightened to near awakening level. This is when we're experiencing our most vivid dreams and the brain performs vital cognitive functions, working to process information, emotions, and memories. And viewers, I think that is one of the reasons we normally remember dreams. So the question is, how does sleep deprivation affect brain functioning and memory? A lack of sleep can have negative psychological health impacts, as the brain is not allowed sufficient time to process thoughts and events. Feeling unable to think clearly and having difficulty remembering recent events are common experiences and symptoms of sleep deprivation. What are the recommended hours of sleep? I think this is again a very interesting question. I would say that the amount of sleep that we require depends upon our age. Our sleeping habits and the amount of sleep that we require changes throughout our lives. Babies, toddlers, and young children will require longer night sleep and regular naps to support healthy brain growth and development. The following guidelines are recommended. If you are a parent, you will see that the newborn or the newborn up to 3 months is likely to sleep from 14 to 17 hours. The infant from 4 months to 12 months old is likely to sleep anywhere between 12 to 16 hours. A toddler, let's say around 2 years of age, will sleep around 11 to 14 hours. Children from 3 to 5 years of age likely to sleep 10 to 13 hours. Older children, 9 to 12. Teenage years, 8 to 10 hours. Adults, 18 and above, 7 to 9 hours. Sleep should be sufficient for them. There are some other interesting concepts and disorders that occur whilst we are asleep. One of them is sleep apnea, and the other is memory loss. People with sleep apnea, which essentially means that the person will stop breathing for a short while, often these people have a lower quality of sleep due to the frequent pauses in breathing, which causes regular sleep disruptions. This interrupts the brain restorative housekeeping functions, which impacts adversely on the memory, creating processes which can then affect short-term memory and retention and recall of events. So whilst we've discussed the short-term effects, positive effects of sleep, and some of the negative effects if we are deprived of sleep, we will now go on to talk about the long-term impacts of poor sleep on cognition. Cognition simply means in the way you think. It is quite common, as people have noticed who have sleep problems, that they're likely to be irritable, they feel fatigued, they have difficulty concentrating following a disturbed night's sleep. The short-term effects usually subside throughout the day, or when we are able, the brain removes the toxic proteins whilst we are asleep, such as beta amyloid, which is a plaque-like substance linked to Alzheimer's disease. Over an extended period of time, a severe lack of sleep can cause these harmful toxins to multiply and eventually damage the brain cells. So to rest and recuperate, to catch up, we need sleep. And when the sleep is lost, so are the vital restorative functions of the brain.